Hi, welcome back. It's Dr. Somji.
And it's Dr. Solomon here.
Today we're going to be talking about a topic called microneedling. It's one of the most popular treatments that you can see at most practices worldwide, but also at home microneedling as well. We've got a separate video about mine and Henel's, my wife's, recommendations for microneedling at home. But today we're going to be talking about the science behind microneedling, why it works, what it works for, as well as the different types of microneedling as well, and particularly looking at what we do in clinic.
Let's start by talking about the different types.
So, look, mechanical microneedling. We're talking about, just a series of small needles inserting into the skin at set depths. It can be anywhere between kind of 0.1 millimeter all the way down to even 4 millimeters in terms of in-clinic treatments. And they create selective damage in the skin that promotes collagen synthesis. That's basically what it does. Now, the earliest microneedling devices were derma rollers, so a series of almost spikes sitting on almost like a circular kind of roller and then rolling that through the skin. Now are very entry-level devices that basically you can use at home now, and very rarely do you really use it in clinic because sometimes you can get dragging with them and they're not all at the same depth. The derma stamp is quite accurate, electric derma stamping. Some of the most famous devices are like Skin Pen, Dermapen 4. The new Dermapen one is probably the most effective because it goes in and out of the skin hundreds of thousands of times and it's very sharp needles that are a lot more accurate as well. And then someone had a great idea of doing something called radiofrequency microneedling, which is the needles go in. Purpose of the needles going in are not actually just to generate collagen. They're there to deliver energy, and in this case, radiofrequency, to cause selective damage again to probably produce more collagen than just normal microneedling.
So what it boils down to is you have a injury caused by the needles, plus or minus heat, and that injury causes a triggering of the repair mechanism of the body. We'll put a diagram to how the body actually repairs that injury.
Yep.
And in that repair mechanism, collagen is made as a side product. And the collagen, the purpose of the collagen is to essentially fill in the void caused by the injury.
Yeah, so like people say, what's the difference between microneedling and radiofrequency microneedling? So popular radiofrequency microneedling like Infini RF, Morpheus 8, all of these kind of devices are very different to what microneedling is, because microneedling is collecting that surface damage, but also you're creating a channel into the skin, and that you can deliver ingredients into there. So after your microneedling, you can spread some hyaluronic acid to increase the hydration. You can put some retinol over that area as well in selected settings and safety upon assessment. But also, nowadays, with the newer devices like Dermafrac, you can actually infuse it as it goes in as well. So I really think that microneedling is about selective damage, almost like a facial, but delivering ingredients, whilst radiofrequency microneedling, the ingredient that is delivered is radiofrequency. Yeah. And that constricts blood vessels, so it can help with people with like rosacea and redness. And it can also stimulate contraction and collagen production.
Yeah, and it's in fact not limited to the skin of the face. You can do microneedling on the body, you can do microneedling on the scalp, and in fact in one of our hair videos we talk about microneedling on the scalp, stimulating injury there, repair, release of growth factors, and potentially thickening hair and existing hair.
Absolutely, well. Any trauma you give on the scalp, it will help grow hair. And believe it or not, even just massaging your scalp vigorously in the shower in the morning, that will grow more hair. Because microneedling, which is not so traumatic, does that too. So, it's a common myth, but anything that you do to stimulate the body is going to essentially grow more. So like when you exercise and your muscles hurt the next day, that's the same pain that's stimulating those muscle fibers to hypertrophy, i.e. to get bigger. Yeah. Same thing that we do with the skin. Same thing in terms of some of the facial exercises that we have on this channel as well.
Yeah, and in fact, skin is a collection of cells, which is a tissue, and muscles a collection of cells, which is a tissue. So the body is very good at repairing tissues up to a certain point and up to a certain age, and we are harnessing that effect, that incredible mechanism that the body has to build from injury.
So, tell me one thing. What is your so you do a lot of acne scarring. We've got loads of acne scarring videos on our channel. Where does microneedling sit for acne scarring?
Microneedling would sit at the intermediary stage of acne scar remodeling. Where I would put it is I divide acne scarring into mainly 3 phases. You're releasing the scar, you're building collagen in the scar, and then you essentially resurface the scar. And in the intermediary phase where you're building collagen, and that can be either using a chemical energy that causes injury and again collagen synthesis, or microneedling energy. And the microneedling energy is either the physical trauma of the microneedling as you described, plus or minus the heat with the radio frequency. So that building of collagen will help the scar lift up, and again we talk about this in our scarring videos, and allowing us to resurface more efficiently when we come to the latter stages of scar remodeling. So I included in almost all scar protocols that I designed for patients. I find it very, very effective, and some will be more effective than others depending on the healing mechanism, depending on the health of the individual. Everyone does heal differently, but I consider it to be an essential process in any treatment that requires collagen remodeling.
Yeah. So any side effects of microneedling that you see?
Very rare. You can cause scarring from microneedling. It depends on where you're treating, it depends on the depth you're treating. So if you're very selective and you're very careful about your anatomy and exactly where you're doing, where for example skin is very thin, you have to be selective how deep you go with the microneedling. Equally, if you're using heat with the microneedling, that heat can be damaging if you overdo the energies used, particularly with the radio frequency. And of course you want to avoid deeper structures or even superficial structures that might be sensitive, for example nerves, veins and arteries. But with a good knowledge of anatomy is essential to any treatment in aesthetics. Most side effects can be avoided. What I don't consider to be side effects, but acceptable adverse effects, would be bruising and swelling.
Yeah.
In fact, the bruising is quite good, because if you do induce some bruising, you release growth factors, and it's the body's way of infusing those sort of exactly like we do with the properties and growth factors that we do infuse using the devices that you described. So
absolutely,
bruising is not, in my books, considered, in your books, considered to be a side effect. It's an acceptable positive effect of the microneedling, and if done correctly at the right depth, using the right devices with a good knowledge of anatomy, I consider it to be a perfectly safe technique.
So yeah, so if you bruise, you don't necessarily lose.
Absolutely.
So the depth is really important. The last thing is really important, what we're going to talk about. It's about the depth. So, and it's all about the architecture of the skin. So if you want to treat things like acne, you don't want to go too deep. So you want to really just limit to about 0.5 to 1 millimeter just into that area, just to make sure that you're targeting those regions to give a little bit more exfoliation within that region, and clearance of the epidermis. And then also, if you want to stimulate collagen, you've got to be at that dermal-epidermal junction at about 2 millimeters. So if you want to stimulate collagen, you can't be at 0.5 to 1 millimeter. You're not really going to generate anything at all. You're just going to have that nice glow and, let's say, slight exfoliation. So if you've got acne scarring and you're sitting at home with a derma roller, and it's only 0.5 millimeters, it's not going to do anything.
Yes.
You need to go at minimum 2 millimeters to hit that depth.
Absolutely. So with microneedling, one size does not fit all.
That's it. Okay, thank you so much. If you have any specific questions about microneedling, just let us know. We also do feature different treatments in our menu as well. So if you look through the playlist, there will be some things about microneedling in action, as well as radio frequency microneedling. And if you have any more kind of ideas or questions, just let us know in the comments below. Don't forget to click subscribe, because that way you get to know about all the latest videos that we release.